Hello friends, welcome to my channel. Friends, today I will explain one of the uh, non-communicable disease, that is hypertension. Hypertension means high blood pressure. Initially, before going to the details of hypertension or high blood pressure, initially we have to know what is mean by blood pressure. High blood pressure means above the normal, that is more than normal, that is high blood pressure. Initially, we have to know what is mean by blood pressure. Yes, blood pressure is the pressure exerted by the blood against the walls of artery is called blood pressure. Means when the heart chambers are get contracted, some amount of the blood is pumped into the walls of arteries. When the blood is pumped by the heart, then the pressure exerted by the blood against the walls of arteries. That pressure is nothing but here blood pressure. ಯಾವಾಗ ಹಾರ್ಟ್ ಚೇಂಬರ್ಸ್ ಕಾಂಟ್ರಾಕ್ಟ್ ಆಗ್ತಾವೋ ಸಮ್ ಅಮೌಂಟ್ ಆಫ್ ಬ್ಲಡ್ ಏನಾಗುತ್ತೆ ಆರ್ಟ್ರಿ ಒಳಗಡೆ ಪಂಪ್ ಆಗಿ ಮುಂದಕ್ಕೆ ಹೋಗುತ್ತೆ. ಆ ಸಮಯದಲ್ಲಿ ಆ ಆರ್ಟ್ರಿ ವಾಲ್ಸ್ಗಳ ಮೇಲೆ ಏನಾಗುತ್ತೆ ಪ್ರೆಷರ್ ಎಕ್ಸರ್ಟ್ ಆಗುತ್ತೆ. ದಟ್ ಪ್ರೆಷರ್ ಇಸ್ ನಥಿಂಗ್ ಬಟ್ ಹಿಯರ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್. ಎಸ್ ದಿ ನಾರ್ಮಲ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಈಸ್ 120/80 millimeter ಆಫ್ ಮರ್ಕ್ಯೂರಿ. ಈ ನಾರ್ಮಲ್ ಎಷ್ಟು ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ 120/80 millimeter ಆಫ್ ಮರ್ಕ್ಯೂರಿ ಇದ್ರೆ ದಟ್ ಈಸ್ ನಾರ್ಮಲ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್. ನೆಕ್ಸ್ಟ್ ಯು ಹ್ಯಾವ್ ಅಂಡರ್ಸ್ಟುಡ್ ನೌ ವಾಟ್ ಈಸ್ ನಾರ್ಮಲ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್. ನೆಕ್ಸ್ಟ್ ಯು ಕ್ಯಾನ್ ಸಿ ವಾಟ್ ಈಸ್ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಆರ್ hypertension. Hypertension means what? Hypertension is a condition in which the systolic blood pressure is 140 millimeter of mercury and the diastolic blood pressure is 90 millimeter of mercury or higher than it is considered as hypertension or high blood pressure. High blood pressure considered as it is the systolic pressure should be 140 or more than it. If that is 120, that is normal. More than 120, that is the 140 or more than 140, that is high blood pressure. And the diastolic blood pressure is 90 or more than 90, that is considered as high blood pressure. Blood pressure increases, that is high blood pressure. That is nothing but hypertension here. If the blood pressure is 140 to 180, that is severe blood pressure. It is approximately 140, that is minor blood pressure here. Minor high blood pressure. I think you understand what is hypertension. Hypertension is a condition in which the systolic blood pressure is 140 millimeter of mercury and the diastolic blood pressure is 90 millimeter of mercury or it's higher. That is considered as hypertension. I think you understand. Next, you can see what are the risk factors for the development of hypertension. Means which are the causes for the development of hypertension. Some of the causes or the risk factors for the development of hypertension, in that first one is obesity. Obesity means greater weight gain, increase the high blood pressure or increasing the blood pressure. When the weight gain increases, when the person get obese, then that is definitely leads to the not only development of hypertension, all types of non-communicable diseases such as coronary heart diseases, stroke, and the diabetes, hypertension, cancer, any types of non-communicable disease develops. When the person get weight, the person should be gain the weight according to the height. If the height is less, weight is more, then definitely leads to the development of all types of non-communicable diseases including hypertension. Keep in your mind. Obese is one of the major risk factors for the development of hypertension. Epidemiological observations have identified the obesity as a risk factor for hypertension. ಕೆಲವೊಂದಿಷ್ಟು ಸರ್ವೆಗಳನ್ನು ಮಾಡಿದ್ದಾರೆ, ಅದರಲ್ಲಿ ಒಬೆಸಿಟಿ ಅನ್ನೋದು ಒಂದು ಮೇಜರ್ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಆಗಿದೆ. ನೆಕ್ಸ್ಟ್ ಸೆಕೆಂಡ್ ಒನ್, salt intake. Salt intake means excessive consumption of salt, that is 7 to 8 grams per day, that leads to increasing the blood pressure. If you've taken the salt normal, that is good for health. If you taken excess salt, that is also one of the risk factor for development of hypertension or high blood pressure. Next, you can see alcohol. Alcohol is also one of the risk factor for the development of not only hypertension, all types of non-communicable diseases even nowadays. Excessive consumption of alcohol, that is more than 75 grams per day, leads to increasing the blood pressure. If you taken the normal alcohol, that is 75 grams, within the 75 grams per day, that is good for health and as well as health of the heart. If you taken excess alcohol, that is more than 75 grams per day, that is definitely leads to the not only hypertension, all types of non-communicable diseases. Because when you taken the alcohol, excess alcohol, that is indirectly leads to the weight gain, that is leads to the such types of development of such types of non-communicable diseases. Next, you can see alcohol consumption rises systolic more than diastolic blood pressure. When you taken the alcohol, it increases the systolic blood pressure more than the diastolic blood pressure. Systolic blood pressure means when the heart chambers are get contracted, then the pressure exerted by the blood against the walls of arteries, that is systolic blood pressure. Diastolic means after contracting the heart chambers, then they have to get relaxed. During the time of relaxation of heart chambers, the pressure exerted by the blood against the walls of arteries, that is called diastolic blood pressure. Means while the heart chambers are get relaxing, at that time the pressure exerted by the blood, that is called diastolic blood pressure. Systolic means contraction, diastolic means during time of diastole of heart chambers, pressure, which pressure exerted by the blood against the walls of arteries, that is diastolic blood pressure. Next, you can see physical activity. This is also one of the major risk factor for the development of not only hypertension, all types of non-communicable diseases. Lack of physical activity is one of increasing the body weight, that is indirectly leads to the high blood pressure. If you do not make any work, only taking lunch and sleeping, the food what we have eaten, that is not melt, it is all deposited in the blood in the form of LDL cholesterol, that is indirectly leads to the development of this hypertension. Means even nowadays the lack of physical activity is one of the major risk factor for the development of all types of these non-communicable diseases, because even nowadays there is no physical work, there is only mental work. For that purpose, such types of non-communicable diseases are developing even nowadays. So always we have to involve in the hard physical activities daily, or we have to make the yoga, exercise, yoga, meditation, we have to involve in this to prevent the development of hypertension. Next, you can see type A personality. Type A personality means associated with competitive drive, restlessness, hostility, and a sense of urgency, impatience, all leads to the development of hypertension. Even nowadays, the lifestyle is became changed. Even nowadays, there is no rest. There is competitive drive. Compared to the past, even nowadays the lifestyle became so changed. because even nowadays there is competition, lot of competition, and there is tension, there is stress, and there is no rest, and hostility, and a sense of urgency, impatience. These are all definitely indirectly leads to the development of these types of non-communicable diseases, including hypertension. So the lifestyle is, compared to the past, even nowadays the lifestyle became so changed. So this is also one of the risk factor for the development of hypertension or high blood pressure. Next, you can see, and also some of the other risk factors are also leading to the development of diseases. These are all non-modifiable risk factors. Non-modifiable risk factors means we can't change these. Okay, age, for example, age. The blood pressure rises with age in both sexes, but the rise is greater in those with the initial blood pressure is high. After aging, automatically blood pressure is increases compared to the younger generation. Old age generation, after aging, it is automatically what happens, the blood pressure increase, so we can't do anything for this. So it is one of the non-modifiable risk factor. ಏಜ್ ಆದಂಗೆ ಇಂಥವು ಡಿಸೀಸ್ಗಳು ಡೆವಲಪ್ ಆಗ್ತಾನೆ ಇರ್ತವೆ, ಅವಕ್ಕೆ ಏನೋ ಮಾಡಲಿಕ್ಕೆ ಆಗೋದು. ನೆಕ್ಸ್ಟ್, ಸೆಕ್ಸ್. Sex means, however, adolescent men display higher blood pressure than women. The blood pressure is difference between the sexes, male and female. The men having the more blood pressure than the female. So it is one of the non-modifiable risk factor. So we can't change this. Next, you can see genetic factors. Genetic factor means the blood pressure, level of blood pressure is determined by a part of genetic factors by inheritance. Means if the high blood pressure, hypertension is in your past generation, in the future generation also it is caused due to the some of the genetic factors. So it is one of the non-modifiable risk factors. So we can't change this is also. These are all non-modifiable risk factors, so we can't change this. Next, you can see how can you prevent and control the development of hypertension. Hypertension means we have understood, first we have understood blood pressure and high blood pressure and the risk factors, all we have understood. Okay, how can you prevent and control the development of this hypertension? How can you prevent? For the prevention and control of any types of disease, you can follow 3 preventive measures. One is primary prevention, second one is secondary prevention, third one is tertiary prevention. By following these 3 preventive measures, you can prevent and control any types of disease. Okay, primary prevention. Primary prevention means what? Primary prevention can be defined as the action taken prior to the onset of illness which removes the possibility of disease that will even occur. That is done by the interventions like health promotion and specific protection. Okay, it is defined as the action taken prior to the onset of illness. ಅಂದರೆ ರೋಗ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ ಅದು ಬರಲಾರ್ದಂಗೆ ನಾವು ತೆಗೆದುಕೊಳ್ಳುವಂಥ ಕ್ರಮಕ್ಕೆ ನಾವು ಏನಂತೀವಿ? ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತೀವಿ. ರೋಗ ಬಂದ ಮೇಲೆ ಮಾಡುವಂಥದ್ದಲ್ಲ ಇದು, ಬರೋಕ್ಕಿಂತ ಮುಂಚೆನೆ ಅದು ಬರಲಾರ್ದಂಗೆ ಕ್ರಮ ತಗೊಳ್ಳೋದು, ಬಂದ ಮೇಲೆ ಮಾಡುವಂಥದ್ದು ಇದು. ಓಕೆ, ಹೆಲ್ತ್ ಪ್ರಮೋಷನ್, ಇಂಟರ್ವೆನ್ಷನ್ ಏನೇನು ಮಾಡ್ಬೋದು? ಹೆಲ್ತ್ ಪ್ರಮೋಷನ್. ಹೌ ಕ್ಯಾನ್ ಯು ಪ್ರಿವೆಂಟ್ ದಿ primary prevention? How can you follow the primary prevention? Here in the hypertension, what can you do? Here you can write these risk factors by modifying. I have told already the obesity is one of the risk factor for the development of hypertension. We have to write this obesity, and we have to write here always avoid the weight gain. So we have to involve in the hard physical activity, exercise, walking, yoga, meditation. By following all this, you can prevent the development of hypertension. Next, salt intake. I have told the excessive intake of salt that leads to the hypertension. So we have to write here by modifying this. Avoid the excessive consumption of salt to prevent and control the development of hypertension. So simple. Next, alcohol. I have told excessive consumption of alcohol is one of the risk factor. I have told. So we have to write this in the primary prevention. Alcohol. We have to write alcohol, and we have to write here what. Avoid the excessive consumption of alcohol, that is more than 75 grams per day, to prevent the development of hypertension. Simply. Physical activity. Physical activity is one of risk factors. So you have to write physical activity, and you have to write continuation what? Always involved in the hard physical activities, and have to involve in the walking, yoga, meditation, exercise. By following all these measures, you can prevent the development of hypertension in primary prevention. Next, you can see secondary prevention. Secondary prevention means action which halts the progress of the disease at its initial stage and prevents further complications. Means primary prevention what you have made ಬಿಫೋರ್ ದಿ ಆನ್ಸೆಟ್ ಆಫ್ ಇಲ್ನೆಸ್, ಅಂದರೆ ರೋಗ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ ಬರಲಾರ್ದಂಗೆ ಮಾಡುವಂಥದ್ದಕ್ಕೆ ನಾವೇನಂತೀವಿ ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್, ಬರಲಾರ್ದಂಗೆ ಪ್ರಿಕಾಷನ್ ತೊಗೊಳೋದು. ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂದರೆ ಅದೇವಾಗ ಮಾಡುವಂಥದ್ದು. ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂದರೆ ರೋಗ ಬಂದ ಮೇಲೆ ಅದು ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಇದ್ದಾಗಲೇ ಅದಕ್ಕೆ ಏನು ಮಾಡಬಾರ್ದು, ಬೆಳೀಲಿಕ್ಕೆ ಬಿಡಬಾರ್ದು. ಆ್ಯಕ್ಷನ್ ವಿಚ್ ಹಾಲ್ಸ್ ಅಂತ ತಡೆಯಿರೋದು, ಪ್ರೋಗ್ರೆಸ್ ಆಗಲಾರ್ದಂಗೆ ತಡೆಯೋದು, ಮುಂದೆ ಹೋಗ್ಲಿರ್ದಂಗೆ ಆಫ್ ದ ಡಿಸೀಸ್ ಆಟ್ ಇಟ್ಸ್ ಇನಿಷಿಯಲ್ ಸ್ಟೇಜ್, ಮೊದಲ ಹಂತದಲ್ಲೇ ಆ ರೋಗವನ್ನು ಪ್ರೋಗ್ರೆಸ್ ಆಗಲಾರ್ದಂಗೆ ತಡೆ ಹಿಡಿಯುವಂಥದ್ದು. ಆ್ಯಂಡ್ ಪ್ರಿವೆಂಟ್ಸ್ ಫರ್ದರ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆಗಲಾರ್ದಂಗೆ ತಡೆಯುವಂಥದ್ದು. ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲೇ ಮಾಡುವಂಥದ್ದು ಪ್ರೈಮರಿ ಪ್ರಿವೆನ್ಷನ್, ರೋಗ ಬರೋಕ್ಕಿಂತ ಮುಂಚೆ. ಸೆಕೆಂಡ್ರಿ ಪ್ರಿವೆನ್ಷನ್ ಮೀನ್ಸ್ ರೋಗ ಬಂದಮೇಲೆ ಅದು ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಇದ್ದಾಗಲೇ ಅದಕ್ಕೆ ಪ್ರಿವೆಂಟ್ ಮಾಡಬೇಕು. ಸೆಕೆಂಡ್ ಸ್ಟೇಜಿಗೆ ಹೋದ್ಮೇಲೆ ಅಲ್ಲ, ಮತ್ತೆ ಇನಿಷಿಯಲ್ ಸ್ಟೇಜಲ್ಲಿ ಅದು ಬೆಳೀಲಿಕ್ಕೆ ಬಿಡಬಾರದು. ದಟ್ ಈಸ್ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್. ಇನ್ ದಟ್ ಇಂಟರ್ವೆನ್ಷನ್ಸ್ ಆರ್ early diagnosis and adequate treatment. Early diagnosis means when the patient shows any signs and symptoms of the hypertension or high blood pressure, immediately identify the patient and send for the clinical diagnosis. When the case is proves to be positive, immediately start adequate treatment to halt the progress of the disease at its initial stage. ಅದೇನಾದರೂ ಕೇಸ್ ಪ್ರೂವ್ ಆಯಿತು ಅಂತ ಹೇಳಿದ್ರೆ, ಪಾಸಿಟಿವ್ ಅಂತ ಪ್ರೂವ್ ಆಯಿತು ಅಂತ ಹೇಳಿದ್ರೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಏನು ಮಾಡಬೇಕು, ಅದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕು. ಯಾಕಂತ ಹೇಳಿದ್ರೆ ಅದಕ್ಕೆ ಬಿಟ್ಟರೆ ಮುಂದೆ ಅದು ಬೆಳೀತೈತಿ, ಬೆಳೀಲಾರ್ದಂಗೆ ಅಲ್ಲೇ ಅದನ್ನು ಫಸ್ಟ್ ಸ್ಟೇಜಲ್ಲೇ ತಡೆಗಟ್ಟುವಂಥದ್ದು. ದಿಸ್ ಈಸ್ ವೆರಿ ಮಚ್ ಇಂಪಾರ್ಟೆಂಟ್. ಮೊದಲೇ ಬರಲಾರ್ದಂಗೆ ಇರಬೇಕು, ಪ್ರಿಕಾಷನ್ ತಗೋಬೇಕು. ಬಂತು ಅಂತ ಹೇಳಿದ್ರೆ ಅದನ್ನು ಬೆಳೀಲಿಕ್ಕೆ ಬಿಡಬಾರ್ದು. ದಟ್ ಈಸ್ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್. ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. ಎಸ್, ವಾಟ್ ಈಸ್ ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್? The disease which has advanced beyond its early stage, still it is possible to accomplish prevention. What is this? ಈ ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್ ಅಂತ ಹೇಳಿದ್ರೆ ಇದು ಫಸ್ಟ್ ಸ್ಟೇಜು ದಾಟಿಬಿಟ್ಟಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ಅಂದರೆ ಸೆಕೆಂಡ್ ಸ್ಟೇಜು, ಥರ್ಡ್ ಸ್ಟೇಜು, ಆ್ಯಕ್ಷನ್ ವಿಚ್ ಹ್ಯಾಸ್ ಅಡ್ವಾನ್ಸ್ ಬಿಯಾಂಡ್ ಇಟ್ಸ್ ಅರ್ಲಿ ಸ್ಟೇಜ್, ಮೊದಲ ಹಂತ ಕೂಡ ದಾಟಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ಮೊದಲ ಹಂತದಲ್ಲಿದ್ರೆ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್ ಮಾಡ್ಬೋದು. ಫಸ್ಟ್ ಸ್ಟೇಜು ಕ್ರಾಸ್ ಆಗಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಸೆಕೆಂಡ್ ಸ್ಟೇಜು, ಥರ್ಡ್ ಸ್ಟೇಜಿಗೆ ಬಂದುಬಿಟ್ಟಿತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಅಂಥ ಪೇಷಂಟ್ಗೆ ಬಿಡಲಿಕ್ಕಾಗಲ್ಲ, ಅದಕ್ಕೆ ಕೂಡ ಕೆಲವೊಂದಿಷ್ಟು ಪ್ರಿವೆನ್ಷನ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ದಟ್ ಈಸ್ ಟರ್ಷರಿ ಪ್ರಿವೆನ್ಷನ್. ದಿ ಇಂಟರ್ವೆನ್ಷನ್ಸ್ ಆರ್ ಡಿಸೇಬಿಲಿಟಿ ಲಿಮಿಟೇಷನ್ ಆ್ಯಂಡ್ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್. Disability limitation means if due to the any type of disease, if the person is disabling, that you have to limit. If he losing any types of legs, hands or any parts, if he is losing, then it have to limit whatever by your effort. Next, rehabilitation means if due to the loss of any parts, if he lost something, there are more rehabilitation procedures such as physical rehabilitation, emotional rehabilitation, occasional rehabilitation, functional rehabilitation. There are so much rehabilitation procedures. So you have to by providing the rehabilitation procedure for him, then create him to continue his future. ಪುನರ್ವಸತಿಯನ್ನು ಆ ವ್ಯಕ್ತಿ ಕಲ್ಪಿಸಿಕೊಡೋದ್ರ ಮೂಲಕ ಏನು ಮಾಡಬೇಕು, ಅವನಿಗೆ ಇನ್ನೂ ಹೊಸ ಜೀವನವನ್ನು ನಿರೂಪಿಸಬೇಕು. ದಟ್ ಈಸ್ ಟರ್ಷರಿ ಬ್ರಾಂಚ್. This is about the hypertension. We have seen what is blood pressure, and also we have seen what is high blood pressure, and we have seen risk factors for the development of hypertension, and we have seen the non-modifiable risk factors, and we have seen the prevention and control of the hypertension. I think you understand. Please like, share and subscribe my channel, friends. Thank you.